afternoon, everyone. We will begin. My name is David Merriman. I'm a policy and research analyst with the Criminal Justice Coordinating Council's Statistical Analysis Center. That is a mouthful. It is my distinct pleasure to welcome you all today to Using Data to Understand the Juvenile Risk and Needs Landscape, dialogue with education and prevention partners. This presentation is the second in a 2017 presentation series, the purpose of which is to highlight evidence-based and data-driven approaches to improving program effectiveness and enhancing public safety. Before I turn the presentation over to my colleague, Deputy Director Christy Love, I have a few housekeeping items. One, the slides from today's presentation will be emailed to everyone who registered, probably early next week. The second one is that all those who RSVP'd today will be added to the CJCC mailing list, so you'll be getting other correspondence from us, different promotions for trainings that we do, TA sessions, et cetera, et cetera. And the last thing is that, as I said before, this is one in a series of presentations. And on your desk, you should see a paper that looks exactly like this. And that is an advertisement for our next presentation within this series. And that one will be on risk assessment. So we have multiple risk assessment tools used in the district, both in the adult and juvenile justice spheres. So we welcome you all to join us for that session. I will send out a link, a registration link to that with the slides to today's session. With that said, I will stop and turn the mic over to Christy Love, CJCC Deputy Director.
Good afternoon. And hopefully we're all going to be energetic and participatory despite being right after lunch. As David said, my name is Christy Love. I am the Deputy Director of CJCC. I've been told I'm no longer allowed to use the term new Deputy Director. I've been here about 2.5 months, so I think at the 3-month mark I'm going to drop the new. Plus I've been here long enough that I see a lot of familiar faces probably on this end with the OAG crew. So I'm really excited about today's session, really for a couple of reasons, because this will actually be the first Bridging Research Practice session that I'm able to participate in since I've been with CJCC. And then secondly, I get really excited when I see agencies that take a concept like data-driven decision-making or evidence-based decision-making, and they actually put it into practice. And so that's what we're going to hear about today. We're going to have DBH and Posse talk about how they have actually been using data to figure out how we can better serve one of the most vulnerable populations in our city, which is our youth, which I'm sure you all understand. So just in terms of format for today, we're going to allow our presenters to deliver their presentations. And we're going to save all the questions until the end. So if you have that burning question, I'm going to suggest that you jot it down so you don't forget it. And I will do my very best to ensure that our panelists are able to field as many of your questions as possible. All right, so you didn't come to hear me speak, so I'm going to, without further delay, introduce each of our panelists. So from the Office of the State Superintendent of Education, or OSSE, we have Yair Inspector and Amy McLaughlin. Yair is the Director of Policy and Planning for the Division of Health and Wellness at OSSE. Yair leads a team focused on developing and improving policies, resources, and programming that support the health and wellness of all district students. His team works towards this goal through data collection and analysis, program evaluation, both inter and intra-governmental partnership development, strategic planning, and policy development. Prior to joining OSSE, Yair worked as a senior policy advisor for the Bowser administration in the Office of the Deputy Mayor for Education. And while there, he held a portfolio that included student health, community violence prevention, mental health, and special education. And before that, Yair served in DCPS's General Counsel's office, and he also taught 11th grade global history in the South Bronx. And that's a theme I've seen across our panelists. They're not just data wonks, they've also had practical experience working with youth. Then we have Amy, also from OSSE. She is a health education specialist for the Division of Health and Wellness. And as a member of the policy and planning team, she manages the division's data collection projects and coordinates data analysis and reporting efforts around alcohol and drug prevention, sexual health, nutrition, physical activity, mental and emotional health, and disease prevention. Prior to joining Posse, Amy worked in frontline youth development, creating curricula and providing after-school health programming to DC high school students. And prior to that, Amy worked as a communications consultant where she guided public sector clients through online data visualization and strategic communications projects. And last but not least, we have Eric Chapman from the Department of Behavioral Health. Eric is the Substance Use Disorders Prevention Chief for DBH, and he is also the National Prevention Network representative for the District of Columbia. Prior to this role, he served as DBH's community engagement branch manager and was responsible for the oversight of the agency's substance abuse prevention sub-grants and community engagement efforts. Before coming to DBH, Eric was involved in policy work with the criminal and juvenile justice fields and worked in community capacity building as well as youth violence intervention throughout the District of Columbia. So we have a great group of panelists here, and I am going to turn it over to Amy and Yair.
Thank you so much. So we're gonna, can we walk around? Is that okay?
Yeah.
All right, cool. And this, all right. Oh, okay, thank you. So I see a lot of you guys that I know, a lot of you guys that I don't know, but we're very excited to be here and talk to you a bit about some of the really core pieces of work that we do in our team, in our division, in our agency. But before we get into that, let me give you a quick 30-second overview of what Posse is, and then a bit more to what our division does. This is our quick agenda, and we want to be mindful of time because I know we are short already. Okay, so Posse's mission is to remove barriers and create pathways for district residents to receive a great education and prepare them for success in college, career, and life. Of course, that has a direct correlation and a direct feed to the work that we talk here at CJCC, and want to share with you guys exactly how that connects to what we're talking today through our Youth Risk Behavior Survey. Our division's goal, mission, is to work with schools and community-based organizations to promote positive, healthy behaviors and to improve the quality of life for children and youth in the District of Columbia. We really look at juvenile justice as, from our perspective, from the education health lens, as something that starts further upstream. And Eric and I were talking about this yesterday. I'm really thinking about how we use data, what we know that's happening in our schools, what we know what's happening with our students, to ensure that justice for our students is really a matter of access to good quality health programming and services. We go to the next slide. So our core values to that point in Posse is, of course, a focus on our students. Organizational excellence, we have been thinking very deeply and hard in terms of how, as an agency, we improve the way we're structured to focus on our students. I have a little cheat sheet here, relentlessly focused on finding solutions and paths forward to create innovation and skills for our students in navigating difficult challenges that we know all of our students in our district's children face every day. Developing those partnerships, and of course collaborating with folks around the table as we are doing today. Really quickly, our division is split up here. I'm going to skip this slide, but I think you guys are going to get this back. Rose going to get this back? Perfect, so we'll skip it and continue on. So let's talk a bit about health and wellness data and collection overview.
Great, so in the Division of Health and Wellness at Posse, you can think of our data collection efforts as sort of having three arms. The first data collection piece that we have is the school health profiles. This is...
Can you turn the volume up?
Oh, sure. Thank you. The school health profiles is the first thing to think of in terms of data collection in our division. So each year, every school submits information around a variety of topics spanning from nutrition programs at schools, school lunch information, health coverage, nursing coverage in the school, PE minutes, physical activity minutes, et cetera, et cetera. So that really gives you a look at the environment within the schools. Next thing is the Youth Risk Behavior Survey, or YRBS, which you'll hear more about from us today. The YRBS looks at student behavior, and it asks questions ranging from everything to, do you wear a helmet when you ride a bicycle, to do you wear a condom when you're sexually active. The third data collection piece is what we call the HPEA, the Health and PE Assessment. This happens every year among 5th, 8th, and high school students, 5th grade, 8th grade, and high school. And this asks questions, this gets to assessing student knowledge. So were you aware that you should wear a helmet when you ride a bicycle? Did you know that you should wear a condom during sex? So those are the 3 areas of data collection that we work on. And of course, the goal for all of these is improved student outcomes, and that's what we're here to talk more about with you today. This is just a quick overview of each of these 3 projects. The first is the school health profiles. Those collect information around these categories. Again, that happens every year. There's a second school health profile that happens every other year with the CDC, and it gets a bit more in-depth into things like sexual health programming and education, mental health programming, supports and services at schools. So we also administer that every other year, which is worth mentioning here. The HPEA collects information around student knowledge in these categories, which also align to the health and PE standards in DC. And then the YRBS collects information around similar categories. Again, we'll go into that much more in depth later.
Let me just quickly add. So one of the things that we've been working on in the last year or so is really trying to align the way that we are measuring all of these things against each other. And so thinking about how we can connect the types of domains that we're collecting data in to parallel one another. So for example, we just released new physical education and health standards, and they're aligned to these domains that you've seen just now through the Youth Risk Behavior Survey, the Health and Physical Education Assessment, so that we can really look at apples to the greatest degree possible and figure out from that, what are the types of programs that we need to beef up in our schools? What are the type of technical assistance services that we need to beef up? What are the issues in specific parts of our kind of grade bands that we really need to focus on? And so that's given us, I think, a kind of clearer mission as we look through this data.
I think these slides we'll skip for now. There's more information here about our general timeline and process for the YRBS data collection period that just finished a couple of months back in June. But first, we just want to tell you a bit more about the latest results that we have, so the 2015 YRBS results. And we have some slides here for you today to show these results. There's also stacks, I believe, on all the tables around the room on the 2015 report.
Does anybody need a report still that doesn't have one? I'll just pass it along.
Yeah, please take and share. Great, so while you're passes those out, a bit of information at the high level of what the YRBS is. So the Youth Risk Behavior Survey is a survey that's conducted at the national level by the CDC every other year, and also conducted by states and jurisdictions as an optional data collection instrument. DC has been collecting information on youth risk behavior since, I believe, 2007. And the 2015 results are what we have most recently available. As I mentioned, the 2017 data collection period just ended. So where that data is now is with CDC. They're going to analyze it, clean it up, give it back to us, at which point Posse will create the report that looks very similar to the one you have here for 2017. So expect that in January or February. So we collect information around these 6 categories of health risk behaviors. As Yair mentioned, if you open up your report to the table of contents, we've aligned how we report these results with the way that we actually teach health and PE curriculum. So our standards are reflected pretty closely to the way that we report this information. In 2015, participating schools, there were, as you can see here, 88 of 99 schools participated. 20,000 roughly of 25,000 students participated. DC is actually one of the only jurisdictions that administers the YRBS for both middle school and high school levels. As you can imagine, it's a bigger lift to do both. We find it important for a couple of reasons. One, we collect this information using a census technique or census methodology rather than a sample, which allows us to really analyze these results in terms of subpopulations. So we can break down, we can look at behaviors across subpopulation groups, and our numbers are big enough because we do census and ask every school, middle and high, and every student in every school to complete this survey. Our numbers are large enough to where we can actually narrow them down to those levels and share results without exposing student confidentiality.
Let me just also to piggyback off of that, and our DCPS friends will probably attest to this, that is no easy feat. Doing a census level data collection in a district like ours, which has a 55 to 45% split between market share between DCPS and charters, is a complex task. There's a lot of, besides the logistical, there's a lot of issues in terms of just trying to make sure that we are able to persuade our schools that this is an important thing to do, and a lot of that persuasion happens through clarifying, it's exactly why we're in this room today, clarifying why this data is important, how it is to be used to improve programming and practice, and it's something we're constantly trying to work towards. And as Amy said, we are the only jurisdiction that can manage this, and it has proven to be an incredibly useful, despite being challenging, task. And we'll show you the outcomes of that in a moment when we go through some of the data that we collected from 2015.
So we'll dive right in here, starting with alcohol, tobacco, and other drugs. In this category, we can start with some more positive news. Overall, illegal drug and alcohol use has decreased among high school students from the 2012 survey to the 2015. So the question asks, in the past 30 days, how many, in the past 30 days have you participated in these following activities? So the numbers are down to 20% of high school students having at least one drink of alcohol in the past 30 days, down from 31.4, 28.7 for marijuana, down from 32.2, 8.2% for cigarettes, down from 13.8. So overall positive trends that we're seeing from the YRBS data here.
I'm curious, Eric, to see how that translates to.
Yeah, we'll talk more about that too. High school students also reported being less likely to have ridden in a car with a driver who'd been drinking or having driven after drinking. So that's down to 20.4% in 2015 from 25.5 in 2012. And that's again a question about the past 30 days. And I'll pause for a moment here. In the reports that you all have hopefully in front of you by now, there's a set of appendices in the back. That's really interesting data to look through. It provides each of the questions and the way the question was worded, as well as the results for 2015 going all the way back to 2007, I believe.
Yep, and that starts on page 52.
It starts on page 52. Overall, STD and HIV testing was reported as being lower in 2015 compared to 2012. So the numbers there around HIV testing are down to 39% from 44. These are self-reported numbers for testing. Down also pretty more significantly, STD testing overall down to 34% from 50%. These are again among high school students in 2015. High school students who are, this is not very surprising, it wasn't to me, maybe to some of you it is. High school students who are physically active, at least 60 minutes per day, reported higher grades. The grades are self-reported, the activity is self-reported. But not very surprising here, so you can see the numbers kind of go down. As you get to D's and F's, those students are less physically active each day, less involved in sports. We have a question about that in the survey as well. Less surprising data here. I'll hand it off to you here at this point.
So you've seen, it's not all doom and gloom. There are some really I'll be cautiously optimistic about some of the things that we've seen are looking like they're improving. There are some areas, however, that have shown us, certain programmings and resource allocations that need to be reconsidered and address mental health. I'll let you guys read through this. One of the big takeaways for me and from my colleagues at Posse is this third bullet point. Certainly all of these are concerning. 18% of Latina high school girls reporting attempted suicide. That's not suicidal ideation, that is an attempted suicide. So, again, we're talking about, as I said in the beginning, what is juvenile justice for us? The answer from my perspective is addressing something like this. And we know the correlation between mental health and despair and how that will, of course, easily lead down a not so positive path. Let's keep going into mental health and sexual identity. One of the things that we've seen, again, that's of great concern is this significant discrepancy between heterosexual and gay, lesbian, bisexual high school students in their responses to questions regarding depressed mood and suicide. I'll let you look at this momentarily. Again, you'll see some really significant disparities here between the two, or in the two boxes that we've highlighted. Percentage of students who seriously consider attempting suicide, the disparity is at 22% for gay, lesbian, bisexual. And by the way, again, this is why census data is so critical. We would not be able to provide you this subpopulation data without going to that extra length of providing, or going through the census process. I think also of great interest to the folks around the room is some of these correlations, or I should say just findings from the YRBS in terms of students receiving A's, B's, C's, and D's and F's, and their responses to questions about being in a physical altercation, carrying a weapon, and so forth. I'll just flip really quickly back to this slide here in terms of physical activity, right? So you see here, percentage of high school students who received mostly A's, physically active 60 minutes per day, 35. And if you just kind of compare that here to what that means in terms of staying out of some really risky behaviors, I think it's a really strong argument for why physical activity is essential. Again, some other concerning disparities between students who self-identify as heterosexual and LGBT in middle school, those who felt unsafe at school, a disparity of 6%, those who have been afraid of being beaten up at school, and then at the very bottom, percentage of students who were bullied on school property. You have it there. Okay, so let's talk about challenges and opportunities in YRBS data sharing. So, as kind of was highlighted initially, we have challenges as we are a very diverse district in terms of the education landscape, in getting folks to participate in YRBS. And the way we get them to do so is by ensuring and clarifying for them why doing this can lead to direct additional positive outcomes for their students. One of the challenges we have to overcome, and it is our responsibility to figure out innovative ways to do it, but ensuring, and that is to share data while ensuring student confidentiality. We cannot provide a geocode of a student's home because we do not collect a student's identity of any sort, name, student USID, none of that. We are also very sensitive to sharing information that could then kind of be backward mapped to a student, right? If we know that there is one Latina girl in 3rd grade in this school, you can figure out exactly who that student is, and so the N size limitations are of course a concern as well. And we need to ensure that our partners that we share this data with will keep utmost fidelity to our students' privacy. We're talking about some of the most sensitive data you can share with anybody: sexual, criminal, and all of these types of other behaviors, and so we want to make sure that we are very sensitive to that. We also, to be frank, have, like every other agency around the room, capacity issues, and thinking about how we navigate those is an ongoing conversation, and we're working through that. And then there is the process that Amy touched on, which is how do we get data quickly from CDC. Our 2017 survey ended in June, and we will not receive our raw data until October at the earliest, and so we're already behind the 8 ball, right? And so we need to then have the resources and processes already in place to push this data out as quickly as possible. Schools want timely, actionable data, and we have to work through these challenges and limitations. And I've already touched on that last bullet point there. Opportunities for leveraging YRBS data. So we were talking a bit before we all convened. Some of the things that we need to do is just think outside the box, right? How do we get past the N size issue? Well, perhaps one of the things we can do, and we're thinking about this currently, is clustering schools with similar profiles and saying, okay, school A, B, C, D, and E, we can't give you each of your data sets because we would be exposing one of your students' identity, but maybe we can give you as a collective, because you share the same profile, all your data together, and you can come up with essentially the same outcomes and takeaways that way. One of the ways we could do this also is by zip code clustering of the schools and not the students' homes. And then really, again, the reason we're here around the table with you guys is partnerships with interagency stakeholders who can support us by combining their efforts along with us. By that I mean other surveys, other data collection tools to really get an additional profile of our students in the district. And we are, to this 4th bullet point here, streamlining the data reporting and the QA process internally and with CDC, and trying to think about this in a more holistic way so that we don't have to reinvent the process every administration. Thinking about long-term contracts, thinking about ways to kind of create a template report for every administration so that we can easily import the data from CDC when it comes.
So a few notes here on how to access this data. As you know, it's the 2015 data, and a similar process will be available when the 2017 data comes out. Posse, as we've mentioned several times today, has promised anonymity to all participants of this survey. It's something we take really seriously, and we've promised to protect that anonymity to the full extent of both federal and state law. So because we take that really seriously, we have a strict process that we use for data sharing that often involves an MOU. If we're working with the university, it might involve an IRB approval process. So often, a more direct way to access this data, one is the report itself, the appendices, which is the bottom bullet here. The top bullet refers to just reaching out to perhaps an LEA directly. So each LEA, by that we mean Local Education Authority, DCPS is one, their charter school LEAs, was given their data after the 2015 results came out. So LEAs have agreements, you can put an agreement in place with an LEA as well to access data that way. Posse also has a data request portal. The link to that is the second link that you see at the bottom here. There's also a CDC Youth Online portal. Through that, you can find nationwide results from the YRBS from 2015 all the way back to its start. And then lastly, and I think the most important thing to take away from this slide about accessing data is contact us, contact myself or Yair, and let us know what it is you're trying to do with the data. Let's work through in collaboration and partnership what you're looking for, and we can be the starting point for whichever of these next steps might be appropriate from there.
And I'm going to blow up Heidi's spot, but Heidi Schumacher is our assistant superintendent. And one of the things that we've been talking about a lot as we've been thinking about the YRBS is really partnering with as many folks as we can to make this data successful. And by successful, I mean make it impactful on the programming. And so this is not lip service. We really want to make sure that those who want to partner with us have the opportunity to do so. And that we think about ways to leveraging our data together for the benefit of district students. And to that point, I think our last slide, maybe not. Here are some of the things that, again, kind of to get to the main emphasis of the bridging practice to this data is, like I said, district agency partnerships, along with our friends at DBH and DOH, thinking about how we can connect this data to resources, how we can connect this to programming in our schools and so forth. Speaking with our non-governmental organization partners, everybody from our local hospitals to other nonprofits that can support us in this work. We are really curious and interested to hear from folks around the room and think further about connecting with our sister jurisdictions and working up to see what are some of these trends that are seen across the DMV and what we can do as kind of that next step in terms of practice. Working with their schools to improve school programming for the Youth Risk Behavior Survey. I'll say one of the things we've heard in the past, I forget which administration this was, but we provided this data to our LEA, and a representative from this particular LEA came up to us and said, you know, we had no idea that we had an inhalants problem in our schools. We didn't know that was an issue. And so they created a whole new part of their curriculum to address that concern. And so there you see direct data to practice supports. And then really thinking about how do we, you know, put our money where our mouth is, and how do we provide grant opportunities in the future to potentially really address some of the Youth Risk Behavior Survey outcomes that we see. And like I said, throughout combining this data with other collection mechanisms to inform the way we do our work. I think we're over time. But that's
Great. Thank you.
Yeah.
Eric.
Good afternoon, everyone. Everyone hear me okay?
Yeah.
Yes. All right. Just had some coffee, so I'm like bouncing. So I need to walk around a little bit to walk it off. That's okay. All right. So my name is Eric Chapman with the DC Department of Behavioral Health. I work in our judicial realignment, so I oversee our substance use disorders prevention efforts. So I'm looking at substance use prevention throughout the District of Columbia. So I'm excited to be here today working with our colleagues here from Posse. I'm also excited to be back at CJCC for a couple hours. Prior to going to DBH, I was employed with CJCC, so I'm glad to be back. All right, very quickly, the mission of DBH is to support prevention, resiliency, and recovery for district residents in need of public mental health services. Also, the vision, the District of Columbia is a thriving community where prevention is possible and recovery from mental health and substance use disorders is the expectation. All right, objectives. So we want to understand the types of data used by the DC Department of Behavioral Health, particularly the substance use disorder services, prevention division and its partners. We also want to develop appreciation for the utility of each type of data. And last, we want to learn how to access data that's readily available to the public. Types of data collected and used. We look at data analytics from our social marketing strategies, qualitative data via community conversations, and quantitative data via surveys that we administer. What's the point? Glad that you asked. And so as you think about this, I want to sort of say this sort of parenthetically, and so you can keep it in front of your mind. The data that we look at, the things that we set in place, are not necessarily to drive policy per se, but more so to guide the work that we do within prevention. And so as you see some of these things, some of the data points that we look at, especially once we do a sort of a correlation between what we have and some of the data from YRBS, is not apples to apples per se, nor is it a challenge, but more so to kind of dig deeper so that we can sort of look at some of the programs that we're identifying and looking at some of the strategies that we'd like to implement throughout the district. All right. Also, as we think about the data analytics piece, the qualitative data and the quantitative data that we look at is not necessarily circular, and as we may look at it through a sort of a build-up perspective, but it's really sort of a two-way street. One thing informs the other. We may have to go back and think about the data analytics, about social marketing strategies. We're looking at what's the reach. How are we reaching folks through our campaigns? Is the content correct? Does it make sense? As we think about the qualitative data, are there any gaps that we're looking at? Are we missing things because of the terms we're using? So we're really kind of having conversation with folks so we get some of this qualitative data. And then lastly, with quantitative data, also kind of connecting back to, are we reaching folks? Are we using the right terminology, et cetera? But also want to evaluate our efforts and what we're doing. All right, social marketing, data analytics. All right, what do we want to know? Well, we want to know, is it working? Is it working? That which we're doing, that's what we're trying to do, the campaign, the social media pages that we have, the website, is it working? Are we reaching our target audience? And if we're not, we may need to revisit some things. Thirdly, is the content current and does it make sense? So if we are calling weed marijuana, but the target population trying to reach is calling it loud or gas, are we reaching them? And then lastly, how are we doing with engagement? So our social marketing strategies. Currently have about 6 or so going on. So the first is our Drug for Youth DC website, where we have all of our social marketing campaigns and literature and things that pertain to our office and what we're doing. All of that can be found there. We also have our Sidearm Merchant Education. Sidearm Merchant Education is dealing with tobacco purchases, primarily preventing it for young folks. The Blunt Truth, which is focused on marijuana. Synthetic prevention for adults. Synthetic prevention for youth, which primarily focused and has focused on K2. And lastly, There's a Reason, which is focused on underage drinking and the prevention of it. Social marketing campaign data analytics. What this is showing here, so as we're working with our public relations team, we want to know what we're doing. So this information is a little less significant in terms of kind of knowing the overall impact of something, because if you think about impressions are literally how many people saw an advertisement, right? So we have a billboard up, and we know that, and I'll use these numbers, that 50 people drive back and forth past the billboard every day. You say, okay, well, we had 100 sets of eyes on it. Well, that doesn't necessarily speak to whether or not something sunk in, right? But we know that it's in a high traffic area. So to think about impressions, if we have something, whether it be online, if we have something, whether it be through our social media pages, how many people saw it? How many likes did we get? How many followers did we have? Is that increasing or decreasing from one quarter to the next? How many posts did we make? Are we making posts on a regular basis to keep the conversation going, to keep the interest going? Engagements. Are people commenting on our social marketing stuff? Are they commenting on our Twitter page? Are they commenting on our IG posts? Are they commenting on our Facebook posts? Are we responding to it? We count the number of responses to those engagements as well. Lastly, the drug, or the 2 P's at the bottom, the Drug for Youth website visitors. How many people are visiting the site? If the traffic is lowering significantly, do we need to change the lookup? Do we need to change the content? Do we need to fresh things? And also looking at our campaigns, and so one of the things will be the Blunt Truth campaign, so the page reviews. How many people are viewing it? All right. Social marketing campaign, and I won't go into a lot of detail with this, but this is really showing a comparison between the first quarter and the second quarter. And so in terms of our number of posts, in terms of our engagements, the engagement rate, the impressions, are we increasing our efforts? Are we increasing our responses? Are we increasing the number of posts that we're making? Are we increasing sort of our engagement rate or the number of engagements that we're having? Are we increasing the impressions? Are we, we're not getting a lot of views in a particular area? Do we need to change that, or do we need to? One of the things we've done, we've had videos that are posted on YouTube. So as we post these videos, we need to sort of pay for it so we can get it sort of further up as we do searches, or as folks do searches. Qualitative data. So we have a sort of a evidence-based approach that we use, which are called community conversations. Community conversations help us to determine what we want to know. So what we want to know is, what are the current substance use trends in the community? One of the key things that we found out through community conversation we had early on was that folks were using synthetic drugs. Prior to that, and this was back in 2012, 2013, K2, we didn't know about it. And so through community conversation, the folks having these conversations said, look, kids are going around, they're going to the store, they're buying incense and they're smoking. And they said K2 and school use snacks and space cadet and all this other stuff. And so that prompted DBH to really kind of look into what was going on. And that helped to sort of launch this campaign, one of our social marketing strategies. Are there terms that we should include in surveys of social marketing strategies? One of the things that we did most recently were, with our recent survey, we asked young people if they were, if they had used prescription medication. Well, are they referring to it as that? If a young person, are they thinking about it through the lens of prescription medication? Or are they thinking about lean? Are they thinking about Percocet? So we know what it is, but are they, when we use these terms, when we use kind of clinical terms, if you will, do they understand the correlation? Because that helps us and that impacts the type of data that we get. Also, what are the beliefs, norms, and practices of respective community where the conversation is taking place? Would alcohol and marijuana or any other substance be more readily available because of the particular community where folks are? Are certain community, or within certain communities, do people hang out in front of a liquor store, and if I'm 8 to 10, I can give you $5, and if I promise to buy you something to drink, then you'll give me something as well. And so really kind of thinking about some of these practices, because that guides the overall work that we're doing. Community conversation. So once again, so this is the purpose of the community conversation with community members is to assist DBH and our DC prevention centers with gathering information on local conditions around substance use and related root causes. Why are people doing what they're doing? We have a substance use issue, but why is it? What is sort of perpetuating that issue? And also we want to assess related community readiness and resources. If we go into a community, we plan on implementing something, what's the readiness of the community? Is the community ready to sort of take ownership of whatever this issue is? Because we need a community buy-in in order to make that a success. Areas of focus for community conversation include consumption patterns of alcohol and marijuana and other drugs, consequences of substance use and abuse in respective community, geographic or target population is different. Are things different east of the river than they are west of the park? Risk and protective factors that influence substance use and prevention resources and infrastructure. This right here probably might be the greatest, in terms of, as we think about qualitative data, this might be kind of one of the greater connections to when we think about the impact as it relates to sort of risk factors in the criminal justice system. So the thing about bullying, shaming from other youth, everything about sort of the lack of trusted adults, explain the consequences, if you recognize alternatives to cope with stress, inconsistent availability within the community. As we think about folks' introduction to the criminal justice system or the juvenile justice system, I would almost bet a dollar to a donut that it's rare that it's some egregious act that's taking place. But it might be something slight that has kind of caused this sort of trajectory into leading or down the path of leading up to the criminal justice system. So what kind of alternatives are we setting in place for young people? How are we engaging young people? Are we educating around this? These quotes over here in the blue are actual quotes from young people who are participating in these community conversations. A lot of girls be going through stuff, so they smoke before they go to school to isolate themselves. I was at a party in my family. Every kid event turned to an adult event, and next thing you know, my cousins brought up bottles, and I was tore up. And so as we think about these things, what opportunities are we creating for young people to engage in substance use? And so a lot of our campaigns are really kind of highlighting whether it be laws, whether it be sort of practices. Once again, this goes back to the community norms piece, the community practices piece. And so these types of conversations, these types of comments help us to understand and structure our social marketing strategies. This right here is just a graphic that talks about sort of the how the community conversation data is used, and it uses sort of whether it be resulting in technical assistance or impacting the program that we're doing, whether it be directly through DBH or whether it be through our DC prevention centers or our partners. Quantitative data via surveys. What do we want to know with regard to this? What's the average age of first use for tobacco and other drugs? How do we know where we need to start in terms of some of the campaigns that we do, some of the language that we do, ways in which we interact with folks. Where do we go? Where within the district do we need to target substance use prevention interventions? Where do we need to go? Are we downtown? Are we in Ward 1? Are we in Ward 7? Are we in Ward 8? How do you feel about using substances? What are the perceptions of risk? Recently, we legalized marijuana use for recreational purposes, even 21 and older. But what message are we sending to young people? If prior to that, we were talking about weed is so bad. And so, what are the perceptions of risk as it pertains to that? This is one of the things we want to know. What's the frequency of substance use among youth, those who do use? So this is sort of a parallel to the YRBS piece. Within the past 30 days, how many days have you used X substance? And lastly, how easy is it for you to access these substances? And so going back to some of the things we kind of look at within the community conversation piece, are there community norms or practices that make substance use easily accessible for young people? All right, just very quickly, just wanted to highlight some of the data resources that we have that are generally available to the public. This is our data infrastructure and reporting systems that we use for our sub-grantees. So there is a part of the website that's locked, and it's more so for them to go in and submit their reports on a monthly basis. But we also have data fact sheets that are available without having to log in. And so we'll look at some of our survey results for youth and adults, and that information is housed on this site as well, and you'll have the presentation, you'll have the link to that. We also have our DCEOW data dashboard, where individuals, based on the data that has been uploaded to the dashboard, can generate reports, can generate graphs that you may use for your own presentation, looking to drive some of the work that you all are doing. Once again, that link is there. That will be in the presentation that you receive as well. All right, very briefly, we want to kind of highlight some of the categories, some of the areas that are highlighted within the DCOW dashboard. So we look at substance use data, we look at consequence data, we also look at risk and protective factors. And so there's a combination of data resources that pour into that, whether we're looking at NISDA data, YRBS data, our youth prevention survey that we have, the alcohol retail license plans. We work with partners such as ABRA, and the DCRA. The prevention survey, once again, the adult piece. And so this data, once collected, pours into our DCEOW data dashboard. And that's something that is available to the public. All right, this right here, we want to do just a slight comparison. And so this information is from the 2015 YRBS report. And so our colleagues from Posse just sort of reviewed this. And this is great. So as we look at the difference between 2012 and 2015, we see in terms of substance use as it pertains to alcohol use and marijuana use between 2012 and 2015 by high school students dropped significantly, right? But also what dropped was the reported age of first use. And so as we think about sort of the alcohol use in 2012, high school students who reported having used alcohol said that they first used at 13. But by the time you get to 2015, those reported using that age dropped down to 12, and this is the average age of first use, dropped to 12.7. Those who used marijuana in 2012, the average age reported was 13.1. And then those who used marijuana, reported using marijuana, the average age of first use was 12.9. Now, one of the things that during the Posse presentation that we kind of looked at was sort of maintaining confidentiality. And so as we look at the YRBS data, it would be very challenging to sort of see where the issues are more prevalent. And so as a means of kind of helping us to guide our work, we've administered what is a telephonic youth survey. Now, once again, as I mentioned, this is not apples to apples. This is not saying that the exact same youth who filled out the YRBS report are the same youth who participated in the telephone survey. Once again, and secondly, the purpose of the survey was not to impact policy, but to guide the work that we're doing, and so we'll get into that. All right, so considerations. Is a reduction in age of first use district-wide? If no, what wards experienced the greatest reduction? So can I get some thoughts from folks? I do want to make this part interactive. As we think about sort of this reduction, so let's look at marijuana, for example, where it went from 13.1 to 12.9. What do we think the reduction took place, if we were to guess? You think about wards, you think about areas of the city. What do you think the reduction, or areas experiencing the greatest reduction?
Ward 5.
Ward 5, okay. Anybody else?
Wards with fewer children.
I'm sorry?
Wards that are getting less and less children, so maybe one.
Ward again, okay, okay. Anybody else?
Ward 4.
Ward 4, okay. I mean, it's not right or wrong. And so the purpose of this is really to highlight the importance of being able to have this ward level data. And so if you look at it, so this the ward with the red box around it is Ward 2. And so the average age of first use, and this is based on self-report, is 12.7. And if we look at Ward 8, for example, it's 13.8. And so in fact, Ward 8 had a higher number than the average that we see in YRBS. So once again, this is not challenging the data in YRBS, but this is driving us in terms of what we do. Without having, anecdotally, we would think that the biggest issue is maybe what you should have heard. So we got to take all these resources to Ward 8 and we got to help everybody over it because that's what the issue is, right? And so it doesn't necessarily mean that we don't focus on all of these areas, but once again, the data that we collect, whether it be the data analytics that we get from our social marketing strategies, whether it be the qualitative data that we get, or whether it be the quantitative data that we have, it drives us and guides us where we need to go. Where do we need to take our resources? What kind of message do we need to come up with? What is our overall approach? How early do we need to start in terms of some of the campaigns that we come up with? Also, one of the things that we found, and this is something that as we generate this report, and we're looking at DC Youth, the telephone survey, and the report of lifetime use, we were actually doing a presentation. I don't think I had paid any attention to it, and the parent stood up and he said, actually, and so we see in the green, most of the youth aren't doing drugs, right? And so it's easy to say, well, everyone's doing it, and these kids is running around, everyone's using substances and getting high, etc. But as you see here, in there, the legend itself is a little small, but the green area are for young people who reported that they don't drink alcohol, that they don't use marijuana, that they don't misuse prescription pills. And so this is important because it shows that there's not some pandemics, isn't reefer madness and everyone's kind of running around and just high all the time. But these young folks, and this is a telephone survey, these young folks are reporting that they don't use. And with those who do use, it's kind of showing us what the issue is and what we need to do. And so these questions, so the alcohol piece is derived from how old were you when you had a drink of alcohol, when you had your first drink of alcohol other than a few drinks. The marijuana piece, how old were you when you first tried marijuana? You tried marijuana for the first time. And then the prescription drug piece is how old were you when you tried using prescription drugs not prescribed to you or that you took only for the experience of feeling they caused for the first time. So it's providing an opportunity for young people to sort of report whether they've done it or not, and then the age. So that's how we got the age of first use that average. We also have an adult prevention telephone survey. And this may be hard to see as well, but we're looking at the availability of drugs. And so as we looked at adults, I think the adult piece was 18. It was broken up between 18 all the way up to 55 or above. Looking at the perception, so in terms of how accessible it is, how accessible marijuana is for folks who are under 21, 84% thought it was pretty easy. Thought it was pretty easy for young folks to have access to marijuana. 77% thought that it was easy for young people to get or have access to alcohol without their parents. Knowledge of community laws is also important. So, this piece up top is reported knowledge of Initiative 71. The Initiative 71 was the initiative that legalized marijuana for recreational use, with 13.6 reported knowledge of the law. And it's been plenty of times I've been doing presentations, having conversations with folks, and literally arguing with someone because they are saying that it's decriminalized as opposed to being legalized. And so really kind of educating folks around that. So our campaign that's addressing marijuana is called The Blunt Truth. And we look at the laws associated with marijuana use. And we also look at the myths associated with it. We want folks to make informed decisions, folks to know, yes, it's legal, but you can't ride down the street smoking a J. I get it. There's no issue, right? The second piece, reported knowledge of law against giving alcohol to minors. And so for those things that have been around for a while, folks may be a little more knowledgeable of it, obviously. But in terms of the Initiative 71 piece, a little less knowledgeable. Community norms and perceptions of risk. And so the question was, very or somewhat likely they would get in trouble for giving marijuana to underage youth. 50% of folks said that they may. So this is half and half. Half of the folks thought that it would be okay or they would get in trouble. The other half thought that they wouldn't get in trouble. Let's think about the alcohol piece. Very or somewhat likely they would get in trouble with alcohol. 47% said that they, might get in trouble. And so once again, the purpose of this is not necessarily to demonize any particular communities, but it's to help guide us in terms of what do we need to do. We need to educate parents or so, whether it be through our There's a Reason campaign, to talk to the young people about underage drinking. Are your kids hanging out? Are they drinking? Do you feel like it's okay for your kid to drink if they're in a home with you? And so really educating folks on the risk of the risk associated with substance use. This right here is just, so this is just some demographic information for the surveys in terms of who responded, sort of demographic breakdown of it. So these are sort of the data collection limitations. Once again, it's not apples to apples. It's self-reported information. And so a person could be lying. I mean, they can say whatever they want to say, right? But we're really going off of whatever that self-reported data is. And once again, not to create any kind of district-wide policy, but to guide the work that we're doing, to guide the campaigns we're doing, to guide the interventions that we're setting in place. Lastly, these are sources and acknowledgments. So we have links to the more recent YRBS report, links to our data fact sheets that's listed on that first graph that I showed, our data dashboard. This is just acknowledging our evaluation partners in this additional information.
Great. Thank you to our presenters for very informative presentations and discussions of data. So I do want to open it up. We have about 35 minutes or so for Q&A. Anyone have questions?
I'll ask when I'll start the
Yes,
process.
go ahead.
Thinking about grant season, which is only a season away, can you talk to us, at least for the prevention partners, those of us who write grants in the room, either on the criminal justice side or the prevention side, what data do you all have that you think would be useful for that? I know you guys have some fact sheets. Are there any directions you push people in?
I would definitely say, to those websites we referenced, it has tons of data, whether it be with regard to the age of first use, the frequency, some of the consequence data associated with it, perception. So depending on the type of grant that you're writing, what you hope to do, there should be something there to, at the very least, get you started and kind of substantiate whatever direction that someone would want to take.
Is it ward or neighborhood specific?
It's ward. A lot of the data, primarily with the fact sheets, they're broken up per ward. So we have a district-wide report, and we also have ward-level report, ward-level reports for youth in particular. And we had a survey that was administered for this year, and that those data fact sheets should be up, I would imagine, within a month on that site as well. So you can do a comparison between the 2 years.
So we have, so certainly the report that you have in front of you, I think is a good resource, and we can talk more about some others right now. One of the things that, in fact, we've been working on in our division is really actually as a division that provides grants, is thinking about creating an equity lens for our grants. And so thinking about looking at things that traditionally some folks have not looked at in the past. One of those would be the equity reports that the Posse provides, and it's on our website. We can share that with the folks around the room for you, David. Another would be the HSA report, which comes out annually, and is a kind of a snapshot of which is a mandate through the Healthy Schools Act, of what's happening in our schools, and you can find schools specific to specific wards and how they are faring in terms of everything from school gardens to physical activity minutes to everything in between, and thinking about how that relates again, as we've shown, to the mental, social, emotional, behavioral health of students, and how that translates into their involvement with the juvenile justice system. Anything else?
So I have a question regarding the data that you all presented. Has this information, or will this information help shape the school-based
So, and that's still remains to be seen. We were kind of chatting about that earlier. So within the Department of Behavioral Health, we do have a school mental health side of that, and we're going through this merger, so we're now sort of housed under the same umbrella, if you will. So this data overall will shape whether it be a campaign we come up with, whether it be some type of intervention that we identify, some type of some practice or strategy that we employ. And so, however, we need to sort of contribute, whether it be through that type of effort or through anything else we're doing in the community, definitely will sort of guide what we do. So.
I mean, no, I echo that. I mean, all I will say is we are excited to take our partnership in terms of data sharing from the Youth-Risk Behavior Survey to the next level. And that means to really think strategically about what exactly that means to the way we do, as Eric said, business, and how not only, I mean, it's not about resource application. It's about really thinking about the day-to-day of how we function and where we put our emphasis in terms of programming and so forth. And I think that there's a couple of things down the line that are going to, I think, create a lot of really good impact in our schools and for our students. And looking forward to the next iteration of that task force to be sent.
How do you target or do programming to specific subgroups? For example, your data showed that like Latinas were more likely to commit suicide, or LGBT students were more likely to also commit suicide or have other types of behaviors. So how do you work with schools to provide programming to those specific subpopulations of students?
Yeah, so we have within our division a full suite of subject matter experts that are deployed through requests for technical assistance and professional development to support in exactly what you're talking about. We also have, as of last year, gosh, I wish I would have brought our resource guide. We developed this incredible resource guide that we've shared with all of our schools. And it was through, essentially what we've done is we've gotten secret shoppers, students that we work with, to go to different clinics and other service providers across the district, and we've measured their openness, candor, accessibility to the students in working through some of those challenges that we've kind of identified. So both kind of from the clinical side and from the programming side, we've pushed these resources to our schools. Again, but the operative word is resources. It is at the end of the day, the school and the local education agency that are charged with ensuring their students' well-being and instruction, but we make those pieces available and we continue to work on that. And I should also put in a plug, we are working on connecting those resources that I've mentioned to the outcomes of the health and physical education assessment, so that you have this like full lifespan of like, you administered the assessment, you have the data. Now from that data, here are the resources that directly connect to the outcomes that you've seen through the HPEA and YRBS.
I actually have two questions. So the first is looking at the rates of physical engagement and opportunities for youth to serve on athletic teams based on their grades, and looking at the correlation between the CIA goals about having a minimum 2.0 GPA in order to participate in competitive sports. So whether this data can be used to help address those rules and maybe create a probationary acceptance of students if they agree to tutoring a certain amount of time a month or something like that, to even pilot it at different schools to see if that would be possible, and what sort of conversations are happening around those types of rules that help young people and push them further into risky behaviors because they're kept out of those opportunities. And then the other question, Reagan and myself are both here. I'm sort of full purpose. I work for DCPS, but we're both in the Masters of Social Work program at Howard. And so we are always curious about the opportunities for students who are interested in doing this work and doing policy and evaluation work projects. And so the question is whether you all have reached out to universities in the area to get involved in the academics process, because there is a very real motivating factor if students have a grade attached to doing the work, and what types of benefits you might see in those types of processes.
So interestingly enough, my colleague Bruce was here. So we had a meeting with American. So we're actually working with American University. So they have a project that they're doing. And so one of the things that we asked them to do in terms of that would be very helpful for us is looking at not necessarily looking, but meeting with sort of representatives from all of the local, within the district, local colleges and universities to figure out how do we engage students around substance use prevention. So whether that is through a classroom effort, whether that is through sort of activities or events taking place on campus, whether it is through forming what we call community prevention networks, and so to really engage folks at the college level around this work, and so really kind of really rely on them to kind of do the legwork of what that might look like, and definitely looking once again kind of looking for that to shape how we sort of allocate funding moving forward, how we work with our prevention centers who are in close proximity to these schools. How do we engage schools, support some of those activities and kind of concerns they have going on that particular campus? So probably less about classroom per se, but getting the conversation going in terms of how we interact with people more, how do we engage a little bit better around these issues.
Yeah, so to answer your second question first, we would be very excited and interested in getting more folks involved, and we have a lot of things that we want to do, a lot of innovation that we want to bring into the data collection process in terms of data to practice that we would love to gain insight and support from community stakeholders, especially universities and colleges. We've worked a lot with American as well, and GW. We need to expand, and it's a conversation that we need to think more about and figure out how to do that. And we'd love to talk to you after this video. The other thing I was going to say is, so DCSAA lives in the Division of Health and Wellness, and so it's something that I think we certainly are considering in terms of kind of your report in terms of a workaround. From our perspective, what we really want to engage with is an opportunity for every student, whether or not you're involved in a after-school team, to be part of physical activity every day. And we are, again, as I mentioned, we're really thinking about how we gear our grants to be more equitable and to ensure that students at schools that may have not had in previous years the opportunity to take part in grants that allow for innovative physical activity opportunities to do so. And so that's really kind of where we're trying to transform. And I'll also mention and urge you to take a look at, there's new proposed legislation that would amend the Healthy Schools Act, which would really promote shared use of school facilities for community-based organizations that would allow for schools to offer all kinds of physical activity opportunities for students. And I should say that's not just after school. I think it's really something that the Healthy Schools Act has always really tried to promote, and I think with some additional kind of shepherding along these proposed amendments, we'll get to that.
Question? Go ahead.
What are we doing to capture data regarding risk behaviors from youth that are either disengaged from school or unenrolled?
So I mean, the sort of telephone survey, sort of 1 to 10. That's why I threw out the caveat that it's not necessarily the same. People who may be in school. It's really based on whatever that sample size is, which is representative of the district and the wards, and whether they answer the phone or not. But that could sort of engage folks who are disengaged. We also have some other what we're calling alternative activities that are taking place within various communities, and so we don't necessarily have a question about whether or not people are in school, but that creates another opportunity to sort of get some information from folks within specific communities with regard to substance use, activity, behaviors, etc. So.
Yeah, and I mean, that is frankly a limitation of the Youth Risk Behavior Survey. It is administered in schools, and it is done so for obvious reasons, right? We want to ensure the confidentiality of our students. That said, there are other measures being taken across the district. I know the Deputy Mayor for Education's office is, and I'm going to get the name wrong, it's not called the Truancy Task Force. It has some
Everyday
fancy
counts.
Everyday counts.
There it is. Everyday counts. That you, I believe, is open to the public and is working towards kind of engaging and thinking about how to collect data and better understand that cohort. I'll also say, and I'm not a statistician, but I will also say the Youth Risk Behavior Survey, one of the benefits is that we're doing a census, and so in theory, I believe that it would be representative of the larger whole, but this is a unique population of those who are truly disengaged, those who are chronically truant, and so I think there definitely needs to be more attention paid to their unique needs as a subpopulation that doesn't participate in the YRBS.
I actually have a question. So I
Yeah.
know, I'm just curious as to how your data could be used by the juvenile justice partners. So I have some experience with YRBS, and I believe it asks questions about victimization, unwanted sexual contact, and other things. And what have been your findings, or what are you seeing there? And is there anything that the juvenile justice community could use in UC to address those needs?
Yeah. I said it at the top. I think that from our perspective, from where we sit at this nexus of health and education, for us, juvenile justice begins further upstream. And the true kind of takeaway that I have seen from the YRBS from this lens is that if we invest more in the health and wellness of our students early on through the provision of grants that support physical activity, through quality mental health services in schools, through partnership with community-based organizations that support our students who need it most, who have a lack of supportive adults in their life and so forth. I think that's what gets you to better outcomes in the juvenile justice system. And I think that it can look a variety of different ways. I think first and foremost, it starts with more conversations like this and more conversations with folks who are on both sides of that spectrum, to have conversations about looking at juvenile justice concerns as health concerns, at least at the early stages when they first crop up. Thoughts?
No, I agree. And so we don't necessarily have anything that that would be a direct correlation between substance use and juvenile justice. But to this point, I mean, definitely kind of looking at it. So as we think about the community conversation, as we think about the feedback and response that we get from folks, what are people saying? Are they saying that we're engaging in antisocial activities and behaviors in general because we don't have something to do, because we don't have a caring adult? Some of the questions that we do ask on our survey is, do you have a caring adult? Have you talked to that person within the past year about substance use? Are you engaged in extracurricular activities? What are your perceptions with drug use? I think there's also we have questions about do you think you would get in trouble for using X, Y, and Z? And so it doesn't go to the extent of something that that would be sort of arrested and kind of sort of committed for, but some of these other kind of where their mindsets in terms of kind of engaging in things that whether it be delinquent acts or something that could kind of start on a trajectory toward the juvenile justice system.
And I remember when I was growing up, we had the DARE program, right?
Mm-hmm.
And I don't know. I mean, I don't know. I'm curious to hear if anybody has any data on that. but it doesn't strike me, I don't know, it did not strike me as very effective. And I think that one of the things that we're learning is it is important to teach about the dangers of drug addiction, and you know, I don't mean to be flip about that, and it's certainly important to teach about the consequences of criminal activity. But I think it's also important to, you know, what if we were to look at this from a different perspective? What if we were to look at this and say, hey, we know in this part of the city, we have serious issues with drug addiction, and so instead of trying to promote, you know, I mean, certainly explaining, and the curriculum is a big piece of it, but how do we engage those students in other healthy activities? You know, can we have that PSA, that police station take part in some larger after-school activity that would not only promote that community policing piece, but also get kids out and get kids moving, right? And so thinking about this again, not just from the punitive perspective, but how do we really transform the conversation from this is like, these are the consequences, which again is important, but really how do we get kids to do something else?
And to that point, there's an interesting finding from the 2015 YRBS that high school students were 1.5 roughly times more likely to be victims of bullying and to bully others if they went, sometimes, most of the time, or sometimes went hungry because there wasn't enough food in the home. So that is another important connection point, that, you know, this isn't just about prevention in terms of how we educate students about what and what not to do and what behaviors are healthy and unhealthy. It's about like their baseline health and looking at food insecurity and how that relates to victimization and bullying. So there's a much bigger lens, much bigger picture to look at it through.
I know you had a question.
Yeah, I'm with the ACE Diversion Program, so sort of to your point, I know you guys said that you were more upstream, but then how do we come to the table to move like past conversation or move beyond conversation to collaboration, as like we are a program that is trying to, you know, provide those interventions and things. What would be the next steps to do that?
So one of the things that we have, and I mentioned it as a tool, but not necessarily kind of the body behind it, but we manage kind of the DC Epidemiological Outcomes Work Group, where we invite partners, whether it be from our sister agencies or even organizations, to kind of come to the table. One, to look at the data as it pertains to just juvenile, young people in general, but also now that we have the data, what? And so how does that kind of impact? So definitely people who are in the community, who have resources, who have programming that we can partner with, definitely, would love to, continue that conversation. Something I would have added to the last piece, we have a mandate from SAMHSA to do what are called alternative activities. And speaking to Yair's point, that has nothing to do with education per se. We're not beating anybody over the head, but what kind of alternatives are we doing that is an alternative, at least for an hour or two, that during that time you're not engaging in some type of antisocial activity, but you're engaging in something fun. You're doing a go-go yoga class, or we're having a good time, we're playing games, kind of engaging folks in a positive way. And so we know that yes, DBH is involved, and yes, it's clear that we don't want you to use substances, but we're not beating you over the head with that, but we're providing a fun activity, an alternative to something. So definitely would love to kind of partner with folks who have the resource, have the ability, or even have the interest to do something like that.
I think, I echo that. I think a part of it too is we have a lot of folks who are well-intentioned and are looking at this report, which is, there are some really sobering things that are happening there, and are trying to drink out of a fire hose. And there is some real benefit in starting small and picking one or two things that you think are within your locus of control, or are within the consortium of agencies and other folks that are around the table to support on, and starting there and really using that data to support practice, I think we'll get a bit further than just trying to tackle the whole thing altogether, although certainly as a district we should aim to do so.
When you're talking about schools that participate and how you break down the data by neighborhoods, are you taking into consideration that kids go between neighborhoods? So,
Yeah.
and the other question I have, you're starting with middle school. Why are you not starting younger? Because early intervention is
Yes.
key here.
Yeah, so let me answer the first question first. And so we don't, as I mentioned, we don't follow the student's zip code. We follow by the school from which they took it. And yeah, I mean, we have the most mobile, I believe, school system in the country. In other words, between, again, like a 55-45 split TCPS charter, our kids move around a lot. Our yellow bus system is the metro, and it is used often. And so there are challenges there. To be candid, because of our fidelity to student confidentiality, we are going to work with what we have. I mean, we have some measures that we can put in place to hone that a bit more. But in terms of the YRBS, it is baked into the deal, and that is that we have data from our schools, and our students come from potentially all 8 wards to any particular school. But I will say again, and as our friends at CDC often mention to us, we are the only jurisdiction to census data, and in theory, the data we have is representative of our population as a whole. That said, of course, we want to get as close to every ward and every neighborhood as we can. As to your second question, which now escapes me because I
Elementary.
Why are you
yes, elementary
starting younger?
yeah, so YRBS is middle school and high school. We have other measures and mechanisms to look into it. I know that a lot of LEAs, local education agencies, are considering a variety of different screeners for ACEs, for adverse childhood experiences, that I think inform practice and clinical need quite a bit. But it is not part of the YRBS. But to your point, and to what I was saying before, these data sets live a bit in silos, and one of the things that we need to work on is to really create a larger narrative on what all of these things tell us together, so that we can build kind of a more comprehensive model for dealing with some of these risky behaviors.
And I'll add as well, I mean, so as we look at the average age of first use, I mean, that is kind of the driving piece. And quite, I was speaking, so from a substance use prevention standpoint, if we were looking at the total sort of age range of young people who we sort of target is 8 to 25. But that average age of first use really kind of helps us to narrow down where we need to start. And so if the average age is 12 or 13, well, maybe we need to start at 11 instead of 8. And this is kind of anecdotal, but even thinking about I remember when I was taking DARE, I was in the 5th grade. So I was 10, I had never even seen, outside of, alcohol in the house, but I never seen a drug, had no exposure to it. But by the time I got to middle school, I wasn't thinking about DARE anymore, but that's kind of when that exposure took place. And so if we can catch folks when they're right on the cusp, they may have an opportunity to kind of sticking in terms of kind of whether it be that campaign, whether it be the message that's sort of speaking to that generation. Not that we don't think about folks who are younger, but once again, just kind of looking at, sort of resources kind of what we have. It'd be great to have a big enough net to catch any and every, youth who potentially use. But as we're looking at folks who kind of reported that age of first use, really trying to catch them so we have the biggest thing for the buck, I guess.
So we are approaching the 2:30 mark. I think we have time to squeeze in one more question, if there is one. Is that your question?
So I know that part of the juvenile justice bill that was passed into law by the city council includes the requirement to look at a root causes of youth becoming involved in the justice system. So I'm curious if Posse is sitting at the table in that process, and including some of the longitudinal information, and whether you all have anything coming down the pipeline to go upstream and to look at the school prison pipeline, starting, I work in Head Start, so starting with trends and policies that exist in Head Start and kindergarten and first grade that begin to funnel, especially Black boys and Black girls, into the justice system,
I may jump in and answer the first, very first part of your question. So it's actually been CJCC in that legislation that's been charged with doing the root cause analysis. So that's something that we're going to start this fiscal year, and of course involve relevant partners in doing that work. But
Yeah, I mean, amen. Yeah, I mean, we are. So let me just give you a sense here. My team in the Division of Health and Wellness, who are all here, fabulous folks, are less than a year old. We are established to, a big part of our mandate is to pull data into practice. We are committed to doing that. A huge part of that effort is exactly what you're describing. It's connecting what we collect and what we know and sharing it with our stakeholders and leveraging it along with other data sets to support in I think that it's shooting too low to keep our students out of the criminal justice system. What we need to be thinking about is how do we get our students to do the wonderful things that we know they are all able to do, and to push them to really achieve an exceptionally high level. And so that is what we are aiming to do with the data that we have, and we will be working along with our folks at CJCC to do so.
all right, well, thank you again to Eric, Amy, and Yair for your great presentations and rich presentations, and thank you all for attending and participating.